Good morning. Thank you very much for joining us for our regularly scheduled Assembly Committee on Business and Professions. Just a few housekeeping items in advance. If any members of the public in the room would like to testify on a bill, please raise your hand and we will ask you to approach the microphone at the appropriate time. You can exit the hearing room once you are done testifying or return to your seat. In addition to being able to testify from inside here in the hearing room, we also have remote testimony stations located on the north steps of the Capitol building. For dial-in witnesses, the access code to call in for this hearing is 877-692-8957. Access code is 2426237. Again, 877-692-8957. Access code is 2426237. You can also find this number on the committee's website as well as your television. Colleagues, please note that there's one item on consent. That's file item number 5. That's SB263, Again, file item number 5, SB263 by Senator Rubio. We'll be acting as a subcommittee since we lack a quorum, and then we'll begin then in file order. We'll begin then in file order number 1. This is Senate Bill 409 by Senator Caballero. I see Senator Caballero here in the chambers. Senator Caballero, this does enjoy two-pass recommendation on both sides, but we will be acting as a subcommittee. Please feel free to present whenever you're ready.
Very good. Thank you, Mr. Chair and members. Thank you for the opportunity to present SB 409. In May 2020, the governor issued an executive order, a waiver of certain CLIA testing restrictions, allowing pharmacists to order COVID tests and collect the necessary specimens. The waiver required, 1, that the test be authorized by the FDA, 2, that the pharmacists be competent and trained to collect the specimen needed for that particular test, and 3, that the specimen be collected consistent with the provisions of the emergency use authorization that was issued by the FDA. The waiver also authorized pharmacists to serve as qualified laboratory testing personnel, but only in the appropriately licensed or registered clinical laboratory under the direction of a laboratory director. This bill would codify that waiver and further allow pharmacists to perform additional waive tests as outlined in the bill or as approved by the Board of Pharmacy and the Medical Board of California. Many of our communities, including those in my district, face significant challenges in obtaining access to testing and vaccines from the onset of the pandemic. People traveled long distances in order to obtain prescriptions, testing, and to receive their vaccines. Many of our communities have at least one pharmacy, and these locations have been key pillars and trusted resources in our communities pre-pandemic, and during the pandemic have served as lifelines to our residents, especially in rural areas, where affordable access to quality health care is difficult to access. It is critical to utilize this resource and highly specialized training and experience of our pharmacists to expand much-needed access to health care in our communities. Here to testify in support of the measure is Ann Sodergren with the State Board of Pharmacy.
Thank you very much, Senator Caballero. We'll begin with the first primary witness in support. Please limit your testimony to no more than 2 minutes. Our Executive Officer of the State Board of Pharmacy.
Good morning, Chairperson Lowe, Vice Chair Flora, and members of the committee. On behalf of the California State Board of Pharmacy, I thank Senator Caballero for authoring this important public health measure and the committee and its staff for its consideration of the measure today. The board is a consumer protection agency charged with regulating the practice of pharmacy. Senate Bill 409 embodies the board's vision, healthy Californians through quality pharmacist care, by expanding access points to specified CLIA waived tests. Senate Bill 409 builds upon a current waiver issued by the DCA Director to expand COVID testing capacity and access points for Californians by providing temporary authority for pharmacists to perform such tests and the expanded testing authority granted under the provisions of Senate Bill 159 in 2019. The success of pharmacist-provided testing demonstrates the important role pharmacists can play in public health. The board believes the permanent and expanded authority sought in Senate Bill 409 is in the best interest of Californians and is consistent with the knowledge, skills, and abilities of a pharmacist. A pharmacist education includes a 4-year post-baccalaureate degree in pharmacy. Under the accreditation standards, curriculum includes public health management strategies, national and community-based public health programs, and implementation of activities that advance public health wellness which align with the policy goals of the measure. Permanent authority for pharmacists to perform these tests as specified in the bill is appropriate and necessary to ensure Californians can continue to avail themselves of this expanded access point. Thank you for your time and your consideration.
Thank you very much. We'll now move on to public testimony. Operator, would you please open up the lines for additional members of the public wishing to testify via the telephone conference system?
And thank you. So you please press 1 and then 0 on your telephone keypad. Again, that's 1, 0. You can first go to line of 14. Please go ahead.
Good morning, Mr. Chair and committee members. This is Lindsay Golahorn with the California Retailers Association and National Association of Chain Drugstores, and we are in strong support of SB 409. Thank you.
And next we'll go to line, give me just a moment here. We do have a couple in queue here. We'll go to line 34. Please go ahead.
Good morning, Michelle Rivas with the California Pharmacists Association in support.
Thank you. One moment. And next we can go to line number 36. One moment here. Let me get that. Line 36, you're open. And their line did remove themselves from queue. No further in queue.
Thank you very much. We'll now go on to the public chambers here. Members of the public, please feel free to present when you're ready.
Good morning, Chair, committee members. Emily Hughes with the California Medical Association. Although the association has not had time to take an official position, we do appreciate the author working with us and accepting the amendments in the committee analysis that we are supportive of.
Thank you very much. Seeing no additional members of the public here in the chambers or in our other external rooms, Operator, would you please open up the lines for members of the public wishing to speak in opposition at this time?
Thank you. And again, if you'd like to speak in opposition, you will want to press 1 and then 0 at this time. Once again, that's 1, 0. And currently our queue is at 0.
Okay, thank you very much. No opposition on the phone lines. Seeing no opposition here in the gallery. Any questions or comments for committee members at this time? Dr. Weber.
Thank you, Chair. Thank you, Senator Caballero, and thank you for my impromptu questions. I do look forward to continuing discussing this bill with you. I do have some concerns about the expansive scope of nature that you're giving to the pharmacist. When you, in the bill, now state that the pharmacist may perform any aspect of any FDA-approved test. And then, you go and list a bunch of them. Pharmacists, although they are very well trained, I was very fortunate. At my college, we have one of the best pharmacy schools in the country, and so many of my very, very, very close friends are pharmacists. So I'm very familiar with their training, their scope of training, and what they're not trained for. And so when I look specifically at my area of practice at, STI, there's sexually transmitted infections, knowing that there is an FDA-approved CLIA test for gonorrhea and chlamydia, which was approved in April of this year, I do wonder whether or not a pharmacist has the right training to counsel a patient who comes in, and then, of course, they can't prescribe the medication. So, and then looking at some of these other things, anemia, cardiovascular health, thyroid issues, I definitely see the need to expand the ability for patients to have access. I'm just wondering if maybe this expansion is just a little too much for their training and also for their time. Our pharmacists are very, very busy individuals, and so to have to take time to then do counseling for some conditions that are pretty significant, maybe an extra burden on their plate. But I do definitely appreciate the bill. I will be supporting it today, and I do look forward to continuing to talk with you about this expansion and their scope of practice. But thank you.
Thank you very much, Dr. Weber. Senator Caballero, do you wish to close?
Thank you very much, and I want to thank Dr. Weber for the little discussion we had right before. What's important about this bill is that not all pharmacists have to do this. It's really a opportunity, and I would respectfully ask for your eye, but I look for the opportunity to continue these conversations. So thank you.
Thank you very much, Senator Caballero. We'll establish a quorum.
Lowe.
Here.
Flora. Here. Berman. Bloom. Chen. Here. Chu. Cunningham. Daly. Fong. Here. Gibson. Here. Grayson. Here. Holden. Irwin. Here. McCarty. Medina. Here. Mullen. Salas. Ting. Weber. Quorum has been established.
Great, we have established quorum. I'll take that motion then from Dr. Weber and also a second from Senator Gibson. Committee Secretary, please call the roll.
SB 409 Caballero do pass as amended to appropriations. Lowe.
Aye.
Lowe, aye. Flora. Aye. Flora, aye. Berman. Bloom. Chen. Aye. Chen, aye. Chu. Cunningham. Daly. Daly, aye. Fong. Fong, aye. Gibson. Gibson, aye. Grayson. Grayson, aye. Holden. Irwin. McCarty. Medina. Medina, aye. Mullen. Salas. Ting. Weber. Weber, aye. SB 409 has 9 votes.
Okay, we'll leave the roll open for additional members. Thank you very much, Senator Caballero.
Thank you, Mr. Chair.
Next up, colleagues, we'll go to file item number 2. This is SB 757 by Senator Limon. Senator Limon, this green carpet matches you very well. This does enjoy a due pass recommendation on both sides of the aisle. Please feel free to present whenever you're ready.
Thank you very much, Chair members.
Second.
Thank you. Since the bill already has a motion and a second, then I will just go straight to my witnesses, as I do remember the green carpet ways. And we have Lourdes Oliva from the Dolores Huerta Foundation and Michael Jemnetz from the Contractor State Licensing Board to speak in support of the bill.
Thank you very much, Senator Limon. We have 2 support witnesses. If you could kindly limit your testimony to no more than 2 minutes each. Let's begin with the representative from the Dolores Huerta Foundation.
Yes, hello, can you hear me?
Yes, welcome.
Perfect, thank you very much. This is Lourdes Oliva, a community organizer with the Dolores Huerta Foundation, and I'm in strong support of SB 757 and also grateful spirit for on behalf of our participants. When we came across this issue 3 or 4 years ago now, our families did not see any hope, and I am very hopeful to say and to go back to them and tell them that we have a legislature that sees the importance of protecting our consumers. Solar energy is needed for our environment and for our families to save money and energy, but we also need protections from the business clauses that have, up to this day, sacrificed many families' happiness and well-being. So I strongly support that you and all the committee see the importance of helping our consumers who have been suffering from fraudulent practices and also unscrupulous people who see the way to take advantage of vulnerable communities. Our community is very, very much in need of being supported and also being motivated to become earth-friendly. And solar is the way that we do need those practices in business to be ethical and to be practical and to be also useful for all consumers in California. I thank you so much for all the work that's been happening and especially all our task force. They put in 3 years of work to make this happen. I have very much appreciation, and our foundation supports this bill. Thank you.
Thank you very much. We'll move on to Mike Janemski from the Contractor State Licensing Board.
Good morning, Chair and Vice Chair and members. Mike Janemski for the CSLB. The board did vote to support this measure. The bill clarifies the law as it relates to home improvement contracts and their requirements that licensed contractors are required to comply with as it relates to the installation of solar energy systems in really 3 major ways. Number 1, it ensures that a contract for a residential solar energy system is indeed considered a home improvement in order to receive those protections of the home improvement contract laws. Number two, by ensuring the home improvement salespersons who broker these deals must be registered to the contractor or the contractors they are soliciting, negotiating, or executing contracts for at a given time. And three, by ensuring that the restriction on contractors from accepting payment for work not performed or materials not delivered on a home improvement contract extends to those payments if they're made by third parties as opposed to the homeowner. But that's the statement this morning. I appreciate your time and is certainly available for any technical questions. Thanks.
Thank you very much. Any additional members of the public on the phone lines wishing to speak in support? Excuse me. Operator, would you please open up the lines for members of the public wishing to signify their support?
Thank you. Please press 10 at this time, if so. We'll go line number 14. Please go ahead.
Good morning. This is Lindsay Gollahorn with the California Community Banking Network in support.
And none further in support at this time.
Thank you very much. Seeing no additional members of the public wishing to speak in support here in the chambers, we'll now move on to opposition. Operator, would you please open up the lines for any members of the public wishing to speak in opposition at this time?
And if you'd like to speak in opposition, please press 10 at this time. And currently no participants in queue.
Thank you very much. Seeing no members of the public here in the chambers wishing to speak in opposition at this time, we'll then move on to any questions or comments from committee members. Seeing no questions or comments from committee members, there's been a motion and a second. Senator Limon, do you wish to close?
I respectfully ask for an aye vote.
Thank you very much. Committee Secretary, please call the roll.
SB 757, Limon, due pass to appropriations. Low.
Aye.
Low, aye. Flora. Aye. Flora, aye. Berman. Bloom. Bloom, aye. Chen. Chen, aye. Chu. Cunningham. Dally. Dally, aye. Fong. Fong, aye. Gibson. Gibson, aye. Grayson. Grayson, aye. Holden. Irwin. McCarty. Medina. Medina, aye. Mullen. Solis. Ting. Weber. Weber, aye. 10 ayes, 0 noes.
10 ayes. We'll leave the roll open for additional members.
Thank you very much.
Thank you very much, Senator Limon. Colleagues, we'll move on to file item number 3, which is SB 362 by Senator Newman. Welcome.
Good morning, Mr. Chair. Thank you for having me to your home. Second. And I appreciate the kind welcome. Let me just go straight to my witness, Shane Jerominski, a pharmacy manager who was recently interviewed by NBC as part of their expose on pharmacy practices.
Thank you very much, Senator Newman. We'll move on to primary witnesses in support. If you can kindly keep your testimony to no more than 2 minutes each, please feel free to present when you're ready.
Good morning, Chair and members of the committee. My name is Dr. Shane Jerominski. My wife, Marilyn, and I have been licensed California pharmacists for over 14 years. We were both featured in the NBC nightly news piece that highlighted safety concerns facing our profession. The concerns revolve around quotas imposed on pharmacists and technicians for the sole purpose of increasing profits for corporately owned chain pharmacies. Unfortunately, those concerns have been only exacerbated during the COVID era. I'm here today to implore every lawmaker listening, if you support patient safety, if you support the healthcare professionals throughout our state, please vote in favor of SB 362. Modern-day pharmacists submit to 8 years of rigorous post-secondary education in preparation for a lifetime of serving their patients. We cannot stand idly by now while corporate retail pharmacy interests morph us into a group of glorified salespeople in white coats. Accuracy, empathy, and genuine health care is the goal of every good pharmacist and technician. Metrics that attempt to quantify our worth based on speed, mail order auto refill enrollments, or how quickly we can answer the phone are not only arbitrary, but a danger to our patients. After 10 years of working for corporate-owned chain pharmacies, I transitioned to work in an independent pharmacy practice. The differences cannot be understated. Pharmacists can save healthcare dollars, save trips to clinics or ERs, and literally save patients' life when given the time and opportunity to do so. In the interest of time today, I will conclude my comments and respectfully request your aye vote. Thank you for the opportunity to address you today.
Thank you very much. We'll move on to our next primary witness in support.
Good morning, Mr. Chairman and members. Ed Howard on behalf of the United Food and Commercial Workers, up over 180,000 members, many thousands of whom are pharmacists, pharmacy technicians, and pharmacy staff. We're pleased to co-sponsor this bill with our partners, the California Pharmacy Association. We want to thank your committee staff for all the excellent work they did in helping with amendments, and respectfully ask for your aye vote on this patient protection measure. Thank you.
Thank you very much. Operator, would you please open up the lines for any additional members to signify their support?
Thank you. And if so, please press 10 at this time. And give us just a moment here. First, we'll go to line of number 32. Please go ahead.
Hi, good morning, Chair members. This is Janice O'Malley with the California Labor Federation in support of SB 362. Thank you.
And next, we can go to line of 43. Please go ahead.
Good morning, Zachary Corbo with the California Dental Association. We are also in support. Thank you.
And next, we'll go to line of number 42. Please go ahead.
Thank you, Chair and members. Renee Estuista with the Whiteman Group on behalf of the California Society of Health System Pharmacists in support.
And currently no further participants in queue.
Thank you very much. See any additional witnesses in the chambers here, please feel free to signify your support.
Emily Hughes, California Medical Association, in support.
Thank you very much. Seeing no additional members of the public here in the chambers who are on the phone lines wishing to signify their support, operator, would you please open up the lines for any additional members of the public wishing to signify their opposition?
And if so, please press 10 at this time. Currently none in queue.
Thank you very much. We'll move the conversation then back to members of the committee. There's been a motion and a second. Senator Newman, do you wish to close?
Thank you, Mr. Chair. I just like to thank the witnesses, but also especially thank Chief Consultant Robbie Sumner for working on the amendments despite being on leave. So those amendments strengthen the bill. They also led the California Retailers Association to remove their opposition, and I respectfully ask for an aye vote.
Thank you very much, Senator Newman. Committee Secretary, please call the roll.
SB 362 Newman do pass as amended to appropriations. Low.
Aye.
Low, aye. Flora. Aye. Flora, aye. Berman. Aye. Berman, aye. Bloom. Bloom, aye. Chen. Chu. Cunningham. Daly. Daly, aye. Fong. Fong, aye. Gibson. Gibson, aye. Grayson. Holden. Irwin. Irwin, aye. McCarty. Medina. Medina, aye. Mullen. Mullen, aye. Solis. Ting. Weber. Weber, aye. Eleven ayes, 0 noes.
11 ayes. We'll leave the roll open for additional members.
Thank you, Chair. Thank you, members.
Thank you very much, Senator Newman. Colleagues, while we wait for additional authors, if we could kindly get a motion on consent. This is for file item number 5, SB 263. Okay, moved by Assemblymember Bloom. Second by Vice Chair Flora. Committee Secretary, please call the roll.
Consent item SB 263 Rubio do pass to appropriations. Low.
Aye.
Low, aye. Flora. Aye. Flora, aye. Berman. Aye. Berman, aye. Bloom. Aye. Bloom, aye. Chen. Chen, aye. Chu. Cunningham. Daly. Daly, aye. Fong. Fong, aye. Gibson. Grayson. Holden. Irwin. Irwin, aye. McCarty. Medina. Medina, aye. Mullen. Mullen, aye. Solis. Ting. Weber. Weber, aye. Gibson, aye. Twelve ayes, 0 noes.
It's kind of those things where worries. I was waiting. If we just make an announcement with the colleagues that we're just waiting for additional senators. I know that our sergeants have kindly called them. Senators will adjourn this meeting in 5 minutes if we don't have any additional authors. If you could kindly make your way here to the Assembly chambers. Thank you. Colleagues, will now move on to file item number 4. This is SB803 by Dr. Pan. Dr. Pan, welcome.
Thank you, Mr. Chair, members. Always appreciate Senator Gibson's direction, so got here. Thanks very much for having me here. We're at a crisis point when it comes to STD infections in this country. The CDC estimates that 1 in 5 people in the United States have an STD. In 2018, almost 68 million STD infections were reported, and rates of syphilis, chlamydia, and gonorrhea are up 40% since 2013. And this crisis affects communities across the state, but California youth, people of color, gay, sexual, bisexual, and transgender people are disproportionately affected. Over half of all the STDs in the state are reported among youth. African Americans are 500% more likely to contract gonorrhea and chlamydia than their white counterparts, and these disparities are expected to worsen as a result of the COVID-19 pandemic. California had the second highest syphilis rates in the nation in 2018. Between 2008 and 2018, syphilis rates among women of reproductive age increased by 743%. One of the hardest data points for me to square with has to do with the rates of congenital syphilis, a condition we hoped which is treatable, and we hoped had gone away with the Victorian era. In 2018, more than 329 babies were born with congenital syphilis in California, a 900% increase since 2012. And that year, 20 stillbirths were associated with the disease. Half of congenital syphilis cases occur because of gaps in testing and treatment during prenatal care. This bill will increase access to STD screening and treatment by increasing use of California's expedited partner therapy, permitting HIV counselors to administer rapid STD tests, opening up access to the Family Pack program, requiring insurance coverage for home STD testing, and requiring syphilis screenings and prenatal care. SB803 takes a comprehensive approach to addressing California's STD crisis by expanding access in an equitable way. I respectfully ask for an aye vote, and I have 2 witnesses in support.
Thank you very much, Dr. Pan. We'll begin then with your 2 primary witnesses in support. If you could kindly limit your testimony to no more than 2 minutes each, and we'll begin with Dr. Gary Richwald.
Good morning, Chair Lowe and Assembly Committee members. My name is Dr. Gary Richwald. I'm a physician and communicable disease expert, former director and chief physician of LA County's STD program, the largest in the country, and I teach STD epidemiology at the USC Tech School of Medicine currently. California, as Dr. Pan said, finds itself in an unfortunate predicament in the midst of a series of STD epidemics since the year 2010, with increases over that time period of threefold in syphilis, twofold in gonorrhea, and chlamydia by half again. And what Dr. Pan said, which I want to reemphasize, is that we've had a tenfold increase in congenital syphilis, which means that pregnant mothers and the most vulnerable future California citizens, that is, newborns and fetuses, end up with a debilitating or fatal illness that is fully preventable. So how does this bill address the issue? Number one, increases expedited partner therapy. So if you have gonorrhea or chlamydia, if you're infected, you get medication that you can give to your sex partners so they can be treated as well. This is done in close to 50 states in the United States. Number two, it requires syphilis screening in the third trimester of pregnancy. I was head of the team that used this in the 1990s to address our previous congenital syphilis epidemic, and it was a critical tool in bringing that under control. And last but not least, during the COVID epidemic, we've seen in many areas a 90% reduction in screening for STDs and identification of individuals who are infected so they can be treated. SB803 levels the playing field. During the COVID epidemic, people had to pay out of pocket to do remote testing in their home, collecting specimens and sending them into the laboratory. This bill requires that insurance companies pay for remote home collection, which uses uses well-established new technology to achieve an important goal. So SB803 is an important step towards creating an equitable healthcare system so that individuals have much better access to STD testing and treatment. For all of these reasons, I urge you to vote yes on SB803.
Thank you very much, Dr. Richwald. We now have a second primary witness in support, representing the Black Women for Wellness Action Project.
Good morning, Chair and committee members. My name is Onya Mogikia, and I'm representing Black Women for Wellness Action Project. We are a reproductive justice community-based organization with offices in Los Angeles and Stockton, and are committed to improving the overall health status and well-being of Black women and girls. For decades, California has seen a steady increase, as we've heard, in the rates of STIs, and current data tells us that these diagnoses are now the highest in 30 years. Youth, Black folks, and LGBTQ+ folks bear the disproportionate burden of infection. These figures, these rising STI rates in our state, are not only emblematic of the shortcomings of our infrastructure and the way it has failed our communities, particularly those who are marginalized, they are a canary in the coal mine. Early warnings of the great impact to our public health should we fail to implement interventions that are innovative and responsive to the issues or factors that contribute to these staggering rates. Critical issues such as lack of access to health care and lack of economic mobility and incarceration. We've heard the sobering figures in earlier presentations, and ensuring access to testing and treatment are key to effectively addressing California's STI crisis. SB803 does just that, as we've heard, by, among other things, encouraging the use of expedited partner therapy treatment, a practice deemed effective for partner management by the CDC, expanding access to at-home testing, as well as updating syphilis testing protocols for pregnant people. This is particularly important given that 15% of people with syphilis in the state are pregnant. In fact, congenital syphilis increased 40% nationwide, with 25% of those cases from California alone. I mean, syphilis can be treated with antibiotics that cost less than $1. So bolstering our screening protocols so that we can detect, treat, and prevent is critical, as lack of treatment and the alternative can result in permanent damage. California has certainly made strides to expand access to health care. However, gaps in access to STI screenings and treatment persist. We have the tools to reverse the upward trend, and we have the opportunity to intervene. California must do the needful and invest in our overall public health infrastructure so as to ensure equitable access to health care and the healthy communities that follow. For those reasons, I do respectfully urge an aye vote on SB 306 as it allows us to make these necessary investments in our healthcare infrastructure. Thank you very much for your time and the opportunity to speak on this.
Thank you very much. Operator, would you please open up the lines for additional members of the public wishing to signify their support?
Thank you. And if so, please press 10 at this time. We'll first go to line of number 46. Please go ahead.
Lydia Bourne, representing the American Academy of Pediatrics, California Division. We are in strong support.
Next is line 37. Please go ahead.
Chair and members, Kathy Mossberg on behalf of the San Francisco AIDS Foundation, proud co-sponsor of SB 306, urge your support.
Thank you. Next is line 48. Please go ahead.
Thank you, Mr. Chair and members. Vanessa Kahina on behalf of the California Academy of Family Physicians in support of SB 306.
And next we have line 49.
Andrea Gutierrez on behalf of the California Life Sciences in support.
And next we have line 26. Please go ahead.
Good morning, Mr. Chair and members. This is Erin Evans on behalf of the California Nurse Midwives Association, as well as NARAL Pro-Choice California in support. Thank you.
Next is line 50.
Good morning, Mr. Chair and members. Craig Pulsifer on behalf of APLA Health, a proud co-sponsor and strong support.
And next is line 42.
Thank you, Chair and members. Renee Estuista with the Weideman Group on behalf of the California Society of Health System Pharmacists in support.
Next we'll go to line 30. Please go ahead.
Good morning, Mr. Chair and committee members. Sylvia Castillo with Essential Access Health, a proud co-sponsor of SB 306 in strong support. Thank you.
Next is line 18.
Dr. Donald Limon with the California Academy of Preventive Medicine in support.
Next is line 34. Your line is open. Next we go to line 51. Please go ahead. Line 51, your line is open.
Good morning, Mr. Chair and members. Betsy Armstrong on behalf of the County Health Executives in support of SB 306.
And currently no further in queue.
Thank you very much. Are there any members of the public here in the gallery wishing to speak in support? Seeing none, Operator will now move on to the public testimony in opposition. Would you please open up the lines for members of the public wishing to speak in opposition on SB 306?
If so, please press 1 and then 0. We'll first go to line of 51. Please go ahead. They took some self-five. I apologize. Next, we'll go to line 34. Please go ahead. 34, your line is open. Line 34, we can't hear you. And we'll move on to line 40. Please go ahead.
Morning, Preston Young from the California Chamber of Commerce here in opposition. Thank you.
And currently no further in queue.
Thank you very much. Seeing no additional members of the public here in the chambers wishing to speak in opposition, we'll bring the conversation back to members of the committee. And we'll begin with the chair of the Select Committee on Infectious Diseases, Assemblymember Gibson.
Thank you very much, Mr. Chairman. I want to thank the author for bringing this good, sensible measure before us today. I would like to be considered as a co-author of the bill. I didn't understand it at first until your articulation here today. It absolutely makes sense when you look at barriers and also access to health care. I'm carrying a bill, Assembly Bill 1038, which is a health equity program to empower clinics, and certainly this would empower that community. What we've seen and the data will absolutely show that because of this pandemic, STIs, other sexually transmitted diseases has increased throughout the entire state. And so we have to try to do everything we can to tear down barriers and create access to care. And so I want to thank the author for bringing this sensible measure before us and look forward to voting aye and also as a co-author of the bill. Thank you.
Thank you very much, Assemblymember Gibson. Dr. Weber.
Thank you, Chair. I, too, would like to thank the author, Dr. Pan, for this bill. As an OBGYN, it really means a lot to be able to treat your patient's partner without necessarily knowing that individual's information or having them come into the clinic. And this is very true in our adolescent population, which actually has the highest rates of STIs. Being able to get that other partner in, there are so many different barriers to that. So removing that barrier and being able to give the prescription to the patient and another one for their partner with just the expedited patient treatment on there for the pharmacist to fill really is a game changer. So thank you so very much for that.
Thank you very much, Dr. Weber. Any additional questions or comments at this time? See none. Senator Pan, similarly, thank you very much for bringing this measure forward. When we took a look at it at the committee, I told committee staff, especially as also serving as chair of the California LGBT Legislative Caucus, that this is absolutely should be a priority for us. And make no mistake, thank you very much also for looking at the science behind this. I think with respect to being sex positive and understanding that these things are occurring and let's remove as much stigma as possible and provide access is absolutely critical. And in many communities, there's still great stigma around this. So very much appreciate you championing this issue and would also like the privilege to be added as a co-author as well. Would you wish to close?
Well, thank you so much for your the comments and support. Looking forward to adding both Senator Gibson and Lowe as co-authors, and thank you so much for your leadership in addressing this issue. I respectfully ask for an aye vote. Thank you.
Thank you very much, Dr. Pan. We have a motion by Assemblymember Gibson, seconded by Assemblymember Berman. Committee Secretary, please call the roll.
SB803 Pan, due pass to appropriations. Lowe?
Aye.
Lowe, aye. Flora? No. Flora, no. Berman? Aye. Berman, aye. Bloom? Bloom, aye. Chen? Chu? Cunningham? Cunningham, aye. Daly? Daly, no. Fong? Fong, aye. Gibson? Gibson, aye. Grayson? Grayson, aye. Holden? Holden, aye. Irwin? Irwin, aye. McCarty? Medina? Medina, aye. Mullen? Mullen, aye. Solis? Ting? Weber? Weber, aye. Twelve ayes, 2 noes.
Senator Pan, that has 12 ayes, and maybe just a point of clarification too. I just heard in testimony as well the distinction between STD and STI. Might you give some clarification on the distinctions between the two?
Oh, well, STD stands for sexually transmitted disease, STI, sexually transmitted infection. So they're usually used somewhat synonymously, but appreciate that sometimes that can be some confusion.
Thank you very much. We'll leave the roll open for additional members.
Okay, thank you.
Thank you very much.
Thanks very much.
Colleagues, we'll move on to file item number 6. This is SB803 by Senator Skinner. Senator Skinner, please feel free to present when you're ready. Welcome.
Thank you, Chair. Thank you, members. First, I'd like to accept the committee's amendments, which clarify that the financial incentives can be communicated to patients and removes the language allowing pharmacies to offer price matching for those financial incentives. And I appreciate the good work with the committee on these. The point of SB 524 is to allow patients to use the in-network pharmacy of their choice. As many of us know, we may have a long-term relationship with our pharmacist. There may be an in-network pharmacy close by. There could be any number of reasons why we prefer the in-network pharmacy. However, there's become a trend where patients' benefit managers or prescription benefit managers rather, try to steer the patient to a specific pharmacy and imply that they have no choice but only to use that pharmacy. So what this bill does is basically, of course, the prescription benefit manager can still offer a discount to the pharmacy of their choosing. They can do a variety of things. But if the patient still wants to use the in-network pharmacy of their choosing, they can. So that's the purpose of it, and let me have my witnesses, Jim Gross from the California Pharmacists Association and Craig Pulsifer from APLA Health, testify.
Thank you very much, Senator Skinner. Let's move on to primary witnesses in support. Please limit your testimony to no more than 2 minutes.
Mr. Chair, members, Jim Gross on behalf of the California Pharmacists Association. First, I want to thank Mr. Chi for very hard work over the last week, working on amendments and reaching a point where we have accommodated some of the concerns that have been raised by the opposition. As Senator Skinner said, this is an ever-growing practice by large corporate conglomerates that are trying to control the dispensing of prescription drugs through their brick-and-mortar pharmacies and through their mail order. And while we recognize that there is value to both mail order and some of the pharmacies owned by these corporate conglomerates, we do not believe it's in the patient's best interest to arbitrarily steer them away from the pharmacies that they have been working with and inconvenience them, risk their health, etc. We have tried to craft this bill in a way that balances. I know that some of you have been told that this will expand the ability to handle specialty medications, and you're concerned about that. Let me make sure you understand. There's nothing in California law that limits the ability of pharmacies to dispense specialty drugs. The limits are both technological and logistical, and those will remain. There are some pharmacies that will not be able to do certain things, and that will be appropriate then to have those patients go to other pharmacies. But the opposition hides behind the term specialty. What they mean and what they've always meant, by and large, when they say that, is expensive. And they want to control the dispensing of expensive drugs. And just because a drug is expensive and therefore designated a specialty drug does not mean that other pharmacies cannot dispense it. In fact, in many instances, have already been dispensing it when the PBMs step in and say, we want you to go somewhere else. We think this bill is very pro-consumer, and we ask for your yes vote. Thank you.
Thank you very much. We'll move on to our second witness in support, representing APLA Health.
Good morning, Mr. Chair and members. Craig Pulsifer on behalf of APLA Health and FQHC, and one of the largest HIV service providers in LA County. Today, I'm just going to focus my comments on how patient steering impacts people with HIV and other chronic conditions. And perhaps most importantly, this practice undermines a really critical relationship between patients and their pharmacists. Many patients depend on this personal relationship, sometimes someone they've known for years, to provide accurate information about side effects and to help them remain adherent to their medication. This is especially true for people with HIV and other chronic conditions. Patient steering can also create significant privacy issues, especially for young people, people experiencing domestic violence, and those living in more rural areas. If these patients can't pick up their medication at their pharmacy of choice, and especially if they're required to use mail order, someone could find out about their medical condition, which of course could have disastrous consequences. And it is precisely for these reasons that mandatory mail order has long been recognized to be inappropriate and even unlawful for people with HIV. And lastly, just want to stress the importance of patients being able to pick up their medication at a pharmacy where the pharmacist speaks their language and where they know they will receive culturally competent care. As a surprise to no one on the committee, not having a culturally competent provider is one of the biggest reasons that people fall out of care. This is especially true for LGBT people and communities of color, and patients must have the option to receive their medication from a pharmacy where they know they will receive culturally competent care. Thank you, and I respectfully urge your support for SB 524.
Thank you very much. Operator, would you please open the lines for additional members of the public now, just simply to signify their support?
Thank you. Press 10, please. First, we'll go to line number 43. Please go ahead.
Good morning. Zachary Corbo with the California Dental Association. We are in support. Thank you.
Next is line 53. Please go ahead.
Good morning, Mr. Chair and members. Brandon Marchi with the California Medical Association, also in support.
Next, we have line 55.
Good morning, Mr. Chair and members. Pat Whalen, Ellison Wilson Advocacy here on behalf of United Nurses Association of California, UNAC, UHCP, in strong support.
And next, we have line 56.
Good afternoon. Cher Gonzalez on behalf of the California Chronic Care Coalition in strong support.
And currently no further in queue.
Thank you very much. Seeing no additional members of the public here in the chambers wishing to speak in support, we'll now move on to opposition. We'll now move on to primary witnesses in opposition. Please limit your testimony to no more than 2 minutes. We'll begin with Bill Head from the Dolores Huerta Foundation.
Chair Lowe, Vice Chair Flora, and members of the committee, my name is Bill Head with the Pharmaceutical Care Management Association. Thank you for the opportunity to testify in opposition to SB 524 today. I do want to begin by thanking both the chair and Mr. Chi for all the work on the amendments and the bill and the virtual open door throughout this process. It's very much appreciated. However, we continue to have a concern with the underlying bill for two reasons. One is it takes away one of the important cost savings tools available to health plans provided by PBMs that enable them to stretch their healthcare dollars as far as possible. Under the guise of, patient steering, which we disagree with the premise even existing, it really comes down to market share, trying to get more of the market share. So let's have an open discussion about that, but not do it under the guise of something that simply doesn't exist. So taking away one of those tools is going to, at the end of the day, impact premiums and costs for patients. Secondly, with respect to specialty care, it was mentioned about cost impacting the definition of specialty care. I would add that, or mention rather, that cost is the only factor that the federal government uses in its definition of a specialty drug. So we think it is relevant for this definition to be consistent with federal regulations as well. Also, specialty pharmacies and PBM contracts are required to receive national independent uniform accreditation standards. And the purpose of these standards is to provide patient protection. So the absence of these gives us concern in the definition of potentially opening the door for a network pharmacy to dispense the specialty drug even though it has not been accredited and contracted as a specialty pharmacy. And for these reasons, we urge the committee to vote no on the bill. Thank you, Mr. Chair.
Thank you very much. We'll move on to Preston Young with the California Chamber of Commerce.
Yes, good morning, Mr. Chair and committee members. Preston Young from the California Chamber of Commerce here today in opposition to SB 524. First and foremost, I'd like to thank the committee and Mr. Chi for their hard work, time, and consideration of this bill. We do remain opposed to SB 524 and what is in print today. The overarching concern that we have with the bill is that it would erode the incentive employers, health plans, and insurers have to design and participate in pharmacy networks. These networks include mail-order pharmacies, chain pharmacies, and independent pharmacies. And they help control pharmaceutical costs for patients in addition to health care premiums for employers and employees. SB 524 disrupts this benefit design and the choices plan participants make to reduce pharmaceutical costs, which are substantial. According to the DMHC in 2018, prescription drugs accounted for 12.7% of total health plan premiums. The number of patients in these networks are reduced, the cost controls will be weakened. And unfortunately, while SB 524 is well-intentioned, it will act as a healthcare cost driver. In addition to our cost concerns, SB 524 is also of concern, and we are in opposition because it attempts to regulate how self-insured plans design their benefits. This is an area and space governed by ERISA, and it's federally preempted. So for these reasons, we are opposed to SB 524, and thank you for your time today.
Thank you very much. Now move on to members of the public wishing to signify their opposition on the phone lines. Operators, would you please open up the lines for members of the public wishing to signify their opposition?
Thank you. Again, it's 1 then 0. First, we'll go to line of 17. Please go ahead.
Mr. Chair and members, John Winger on behalf of America's Health Insurance Plans in respectful opposition.
Next, we can go to line of 35. Please go ahead.
Good morning, Mr. Chair, members. Mike Monaghan on behalf of the California State Association of Electrical Workers, California State Pipe Trades Council, and the Western States Council of Sheet Metal Workers. Our concern is that the bill would circumvent the ERISA preemption of our union's trust funds. Thank you.
And next we go to line of 54. Please go ahead.
Mr. Chair and members, this is Erin Ryberg on behalf of the Association of California Life and Health Insurance Companies in respectful opposition.
And currently no further in queue.
Thank you very much. Seeing no additional members of the public wishing to speak in opposition here in the chambers, we'll now move the conversation back to members of the committee for any questions or comments. I will begin with Assemblymember Fong, followed by Assemblymember Chen.
Thank you, Mr. Chair. I just want to thank Senator Skinner for leading the discussion on this issue. This bill provides consumer choice while supporting local pharmacies that best serve the needs of many rural and disadvantaged communities. So I'll be supporting this bill today.
Thank you very much, Assemblymember Fong. We'll take that maybe perhaps as a motion. Great. Assemblymember Chen.
Thank you, Mr. Chair. I appreciate your time. I really want to thank also Senator Skinner for the opportunity for us to have this conversation. I do have some questions, and I certainly appreciate the intent of the bill to add additional ability for people to utilize medication. I also understand in terms of some of the opposition's concerns that one of the issues and points of contention is the utilization of specialty medications. So as I understand it, in order for you to be a specialty medication provider, one has to go through an accreditation process, and it is to ensure patient safety and quality purposes. For the pharmacies that have not received this accreditation, is there an issue in terms of patient safety, quality, dispensing? If you could assist in answering this question, I would appreciate it, Senator.
Through the chair?
Please. Thank you, Senator.
Thank you. The bill, if the particular prescription cannot be filled by the pharmacy of the patient's choice under this bill, and it may or may not be a specialty drug. It could be a different, there's a variety of either compound drugs or such that may not be able to be filled by, say, an independent pharmacy or the pharmacy of the patient's choice. So, of course, then that specialty pharmacy would be utilized, and there's nothing in the bill that would prevent that at all.
Thank you, Senator. And I also have another question. I also understand that one of the points of contention for the pharmacies relates to the definition of a network specialty pharmacy, specifically with the purpose to ensure it will be consistent with the stringent demands imposed on pharmacies by PBMs and plans, given the high cost and sensitive nature of the medications. Given that in mind, Senator, has there been considerations in adopting language relating to the definition of a network specialty pharmacy?
Since this bill allows for in-network pharmacies as defined by the health insurer, we did not feel the necessity to add further definition. And in terms of that argument around cost, so, let's be practical. This bill may benefit some independent pharmacies. However, there are so few independent pharmacies remaining in the state of California, they are certainly not the drivers of high prescription cost. So in the few cases where a patient would choose, either because, say, they live in a rural area and the only pharmacy nearby is that independent pharmacy, or they have a long-term relationship with that independent pharmacist. So as long as they're in network, in the few cases where the patient is going to utilize that pharmacy instead of the one that the PBM might prefer them to use, it is no way that that is driving the cost of prescriptions in this state.
Senator, really appreciate your time.
Thank you.
Thank you very much. Any additional questions or comments at this time? Assemblymember Grayson.
Thank you, Mr. Chair, and thank you to the author for your good work on this bill. There is a part where it talks about a very narrow exemption on specialty drugs within the definition of patient steering.
Right.
And does that align or create a conflict between the agreements between PBMs and pharmacies?
Well, not to my knowledge.
Okay.
And certainly was not brought out so far either in analysis or, and partly because clearly if the specialty drug that you have been prescribed cannot be filled by the pharmacy that may be your choice, you obviously would need to go to the specialty pharmacy that the prescription benefit manager has chosen. So I have a difficult time understanding what is perceived to be a conflict there.
Thank you for your answer. Thank you for your work. Thank you.
Thank you very much, Senator Grayson. Any additional questions or comments at this time? Senator Skinner, do you wish to close?
Thank you. I would just say in my closing that I found it interesting to have the chamber oppose the bill because while it has been characterized that the bill is consumer friendly, which it is also very business friendly. Now, why it's business friendly is because it supports, and we, the legislature, purport to support small businesses, but what it does is help to ensure that in those few cases where the patient wants to use the independent pharmacist, if that independent pharmacist is in the network, they can do so, and the prescription benefit manager cannot exclude them. And so, in other words, it's supporting our small businesses. Now, over time, we may find a situation where many of our health insurers do not include independent pharmacies in the network. But while they are in the network, then we should not have laws that, in effect, further discriminate against them other than our than whatever other market forces may affect their existence. And with that, I ask for your aye vote as amended.
Thank you very much, Senator Skinner, for accepting the committee amendments. You and I communicated also over the holiday weekend on this, and so thank you very much for your hard work and dedication for you specifically as the author, as well as your dedicated staff, and working collaboratively with the committee on helping to strengthen policy for the outcomes for all Californians. With that, there's been a motion by Assemblymember Fong and second by Assemblymember Irwin. Committee Secretary, please call the roll.
SB 524 Skinner do pass as amended to appropriations. Lowe?
Aye.
Lowe, aye. Flora?
Not voting.
Flora not voting. Berman? Aye. Berman, aye. Bloom? Aye. Bloom, aye. Chen? Chen not voting. Chu? Cunningham? Cunningham not voting. Daly? Fong? Fong, aye. Gibson? Grayson? Grayson, aye. Holden? Holden, aye. Irwin? Irwin, aye. McCurdy? McCurdy, aye. Medina? Medina, aye. Mullen? Mullen, aye. Solis? Solis, aye. Ting? Weber? Weber, aye. Twelve ayes, 0 noes.
12 ayes. We'll leave the roll open for additional members. Thank you very much, Senator Skinner. Colleagues, we're just have one more item on the agenda, and that's file item number 7, SB 509 by Senator Wilk, and he is on his way.
I offered to present, he said he wanted it passed. So. On my knees and kiss your ring, and I'll address you properly.
You know, he has big business to do, you know. Colleagues, we'll move on to file item number 7. This is SB 509 by Senator Wilk. Senator Wilk, this does enjoy a due pass recommendation on both sides of the aisle. Please feel free to present whenever you're ready.
Good. Thank you, Mr. Chair and members. Before you today is SB 509, which makes it easier for optometry students to begin working and paying off their student debts during the pandemic. The pandemic has affected every aspect of our lives during the past year, and it has an especially harmful impact on our state's students. For instance, many of California's optometry students have been unable to travel to North Carolina to take the required practical exam, preventing them from obtaining their license and from getting a head start on paying off their student debt. This bill provides a narrow solution to enable those students to obtain a temporary license and begin working under the direct supervision of a fully licensed optometrist. With me today to provide expert testimony and further address any questions that the committee may have is Terry McHale with Aaron Reed and Associates, representing the California Optometric Association.
Thank you very much. We'll move on to primary witness in support, Mr. McHale from the California Optometric Association.
Mr. Chairman, Terry McHale with the California Optometric Association. This provisional license is sensible. It does have restrictions. It does require that the optometrist work under the direct supervision of an optometrist and ophthalmologist who is physically present at the facility. It will allow the optometrist to begin practicing, begin paying off student loans, to begin paying off their own life expenses. And this legislation is a smart way to deal with what this crisis of COVID has wrought upon us, and we ask for an aye vote.
Thank you very much. Operator, would you please open up the lines for any additional members of the public to signify their support?
Thank you. Please press 10 if so. None in queue at this time.
Thank you very much. Seeing no additional members of the public here in the chambers wishing to speak in support, we'll now move on to opposition. Operator, would you please open up the lines for members of the public to signify their opposition?
Once again, it's 1 and then 0 to oppose. And currently none in queue.
Thank you very much. Move the conversation back to members of the committee for any questions or comments. See no questions or comments. Senator Chen.
I encourage an aye vote. Senator Scott Wilk is a personal hero in my personal mind, the walking Buddha of all things good. And I say a vote for this is a vote for goodness and humanity. So please support this bill.
Senator Chen, just for a point of, did I hear you say Buddha? Did you say Buddha?
Walking Buddha, Mr. Chair.
Walking Buddha. Walking Buddha. Just for clarification, the masks are difficult to hear. Thank you for the
Thank you,
record.
Mr. Chair.
Thank you. And I'll take that as a second. Vice Chair Flora.
You know, Senator Wilk, I just appreciate you gracing us with your presence here on the green carpet. You know, as a leader in the Senate, you know, it's just an honor to have you in our presence. So thank you for this glorious piece of legislation.
Any additional grilling from the members of the committee at this point in time? See none. Senator Wilk, do you wish to close?
Sure. I appreciate the comments from my future colleagues. They seem to me like they're Senate material. And with that, I respectfully ask for an aye vote.
Thank you very much. Committee Secretary, please call the roll.
SB 509 Wilk do pass to appropriations. Lowe?
Aye.
Lowe, aye. Flora? Aye. Flora, aye. Berman? Aye. Berman, aye. Bloom? Aye. Bloom, aye. Chen? Aye. Chen, aye. Chu? Cunningham? Aye. Cunningham, aye. Daly? Daly, aye. Fong? Fong, aye. Gibson? Grayson? Grayson, aye. Holden? Holden, aye. Irwin? Irwin, aye. McCarty? McCarty, aye. Medina? Mullen? Mullen, aye. Solis? Solis, aye. Ting? Weber? 14 ayes, 0 noes.
14 ayes, 0 noes. We'll leave the roll open for additional members.
Thank you, Mr. Chair and members.
Thank you very much, Senator Wilk. Colleagues, that concludes the agenda for today. We'll leave the roll open for members to add on.
Consent item SB803 due pass to appropriations. Rubio. Chu. Cunningham. Cunningham, aye. Grayson. Grayson, aye. Holden. Holden, aye. McCarty. McCarty, aye. Salas. Salas, aye. Ting. Seventeen ayes, 0 noes. SB 409 Caballero, due pass as amended to appropriations. Berman. Berman, aye. Bloom. Bloom. Bloom, aye. Chu. Chu, aye. Cunningham. Cunningham, aye. Holden. Holden, aye. Irwin. Irwin, aye. McCarty. McCarty, aye. Mullen. Mullen, aye. Salas. Salas, aye. Ting. Eighteen ayes, 0 noes. SB 757 Limon, due pass to appropriations. Berman. Berman, aye. Chu. Chu, aye. Cunningham. Cunningham, aye. Holden. Irwin. Irwin, aye. McCarty. McCarty, aye. Mullen. Mullen, aye. Salas. Salas, aye. Ting. Holden. Holden, aye. Nineteen ayes, 0 noes. SB 362 Newman, due pass as amended to appropriations. Chen. Chu. Chu, aye. Cunningham. Cunningham, aye. Grayson. Grayson, aye. Holden. Holden, aye. McCarty. McCarty. McCarty, aye. Salas. Salas, aye. Ting. Seventeen ayes, 0 noes. SB 306 Pan, due pass to appropriations. Chu. Chu, aye. McCarty. McCarty, aye. Salas. Salas, aye. Ting. 15 ayes, 2 noes. SB 524 Skinner. Chu. Chu, aye. Dolly. Dolly, no. Gibson.
Yes, aye.
Gibson, aye. Ting. 14 ayes, 1 no. And SB 509 Wilk. Chu. Chu, aye. Gibson.
Aye.
Gibson, aye. Medina. SB 509 Wilk. Medina. Aye. Ting. Weber. Weber, aye. 18 ayes, 0 noes. SB 263 Rubio, due pass to appropriations. Ting. Ting, aye. 18 ayes, 0 noes. SB 409 Caballero, due pass as amended to appropriations. Ting. Ting, aye. 19 ayes, 0 noes. SB 757 Limon, due pass to appropriations. Ting. Ting, aye. 19 ayes, 0 noes. SB 362 Newman, due pass as amended to appropriations. Ting. Ting, aye. 18 ayes, 0 noes. SB 306 Pan, due pass to appropriations. Ting? Aye. Ting, aye. 16 ayes, 2 noes. SB 524 Skinner, due pass is amended to appropriations. Ting? Aye. Ting, aye. 15 ayes, 1 no. SB 509 Wilk, due pass to appropriations. Ting? Aye. Ting, aye. 19 ayes, 0 noes. SB 263 Rubio, due pass to appropriations. Chu? Aye. Chu, aye. 19 ayes, 0 noes.
Oh, yeah, for sure. I got here in time. Drop the kid off. It's for you. We are adjourned.